Fortunate to have two amazing experts on today's panel to guide us through this discussion. I'll provide a brief introduction of both of our speakers. With us today, we have Jalady Turnipseed. Jalady serves as the Director of Thoracic Oncology Program Services and is also a thoracic surgery physician assistant at Novant. She plays a dual role, blending clinical and administrative leadership within the Thoracic Oncology Department, where she directs the Comprehensive Lung Cancer Program. Jalady also serves on the American Lung Association's local leadership board and the Southeast Regional Board. Also joining us today, we have Donna Small. With over 33 years of dedicated experience in oncology nursing, Donna has established herself as a vital member of the healthcare community here in Charlotte. Her career has encompassed a variety of roles, including bedside nursing, clinical research, infusion, and triage. For the past 5 years, Donna has served as a lung cancer nurse navigator at Novant Health Cancer Institute, specializing in lung cancer and neuro-oncology. In this role, she has provided critical support to patients navigating their cancer journeys, ensuring they receive the resources and care they need. Thank you both so much for joining us today. And at this time, I'm going to turn it over to Jalady to get the discussion started.
All right, thank you, Lauren, for having us. We're happy to be here and educate, especially in November, which is Lung Cancer Awareness Month. So it's perfect timing. So before kind of jumping in, and I know everyone has submitted questions for us to discuss, I just wanted to share a couple of facts of why it's so critical and why this topic is so important in our community and worldwide. So having conversations about lung cancer is critical for several compelling reasons. Lung cancer is a global impact. It's the leading cause of cancer-related deaths worldwide, surpassing breast, prostate, and colon cancer. This makes it not only a personal and a family health crisis, but also a global public health issue. Its prominence underscores the urgent need for awareness, early detection, and more effective treatment options that we're here to speak about. Everyday lung cancer claims the lives of more than 357 people, our friends, family, and colleagues. The sheer number of lives lost serves as a stark reminder of the disease's devastating impact, making it essential for us to discuss, understand, and address it in our communities and healthcare systems, like we're doing today. Although we have made great progress, there's still so much more work to be done. The national 5-year survival rate for lung cancer is only 25%, highlighting the aggressive nature of the disease and the challenges it presents for diagnoses and treatments among our healthcare providers. By having conversations about lung cancer, we can advocate for earlier screening, better access to care, and advancement in treatment that could improve outcomes and survival rates. These statistics and facts make it clear that open dialogue is needed to raise awareness, just like American Lung Association provides, reduce stigma, and inspire action for research and improve care. Lung cancer may often be overlooked in favor of other cancers, but these conversations are essential to drive the change that we need, support those affected, and ultimately save lives. So I'm going to go ahead and I'm going to start by discussing our current guidelines for lung cancer screening. The U.S. Preventative Task Force established and updated their guidelines back in March of 2021. And the high-risk individual is going to be someone who meets the current guidelines. That's going to be someone who is age of 50 to 80 years of age, 20-pack-year history of smoking, or a former smoker who has quit within the past 15 years. To explain a little bit about the 20-pack-year history of smoking, that means that it's 1 pack of cigarettes a day for 20 years, or it can be someone who smoked 2 packs a day for 10 years. So now, someone would ask, how do we determine which patients qualify for screening? Well, every single patient that would hit the high-risk criteria that I just talked about can be screened. But unfortunately, currently, there is no criteria set in place to detect lung cancer earlier in people who do not meet this high-risk screening requirements, especially in our non-smoking population. The process for lung cancer screening involves shared decision visit with your provider. During your discussion, your provider and you are going to discuss the benefits and the potential risk of being screened. The great advantage of early detection and getting screened is that the success rate of surviving lung cancer increases to 60%. Nationally, only 24% of cases are caught early, when the 5-year survival rate is at 60. But unfortunately, the majority of our cases, which is about 46%, are caught not until a late stage, when the survival rate is only 6%. How do we continue to detect lung cancer early? Well, this is achieved by not only setting up lung cancer screening programs, but also by having an incidental lung nodule program that would benefit everyone who does not meet that high risk criteria for screening, or someone who's just not aware. For example, here in Novant Health, if someone gets an imaging at some sort of diagnostic workup, whether it's they're going in for an orthopedic procedure and they get a chest x-ray, or they're going for cardiac workup, if someone gets that imaging and it captures the chest cavity and there's an incidental nodule found, we have protocols set in place to alert our lung cancer nurse navigator, such as Donna Smalls, to add the patient to our weekly multidisciplinary rapid lung nodule review. During this weekly review, we discuss findings, recommendations, and a plan of care by the group of experts for each and every single patient, which expedites the care for them and the treatment plan. So spreading awareness and knowing who is at risk, it's crucial. Every 2 minutes, someone in the US is diagnosed with lung cancer. So we have some general questions from patients and caregivers that have also been submitted apart from the high risk criteria. And I'm gonna go ahead and we're gonna dive into those, and I'm gonna have Donna answer most of these questions. And I'll go ahead and start. Donna, if you're ready.
I'm ready.
All right, so the first one is, how do you address the emotional and psychological needs of patients and caregivers throughout a lung cancer journey?
Well, it's really scary to hear the word lung cancer, or just cancer in general. It brings about a lot of different emotions in the patient as well as the family. So I try to listen and just give the patient time to simply talk about it, and ask those questions. I want them to express their concerns and let them know I'm their cheerleader and advocate to support them through the journey. And as a navigator, as well as the other navigators in our Novant Health, we have direct phone numbers to provide the patient and family, so they have ease of access to reach us for any type of questions or problems they need help with, or just to talk through the day. I also want the patients to know that all of their emotions of anger, sadness, anxiety, those are very valid feelings and very normal. I don't want the patient to think what they feel is abnormal or unusual. As far as coping with this, we have counselors here at Novant. We encourage our patients to utilize. They do counseling in person with the patient as well as virtual visits with the patient and family members, and this is free of cost. We also have a chaplain who is accessible to patients to assist with support and helping the patient with advanced directives such as a healthcare power of attorney.
That's great. Well, thank you for mentioning all the resources that they have for coping through the journey of lung cancer. And, I will reiterate the fact that I'm a true believer that our nurse navigators are the heart of the program of any lung cancer program. Like you said, it's the goal, and you help navigate them through that patient continuity of care of all the unknowns. So I think it's absolutely wonderful. Thank you for everything that you do. So the next question is, what resources are available to patients when diagnosed with lung cancer?
We have educational materials we provide to the patient, or I give them when they're first diagnosed at our first meeting. We have booklets that are specific to non-small cell lung cancer as well as small cell lung cancer. In the booklet, there's a lot of good education, and it provides a lot of website resources for lung cancer. One website in particular is the NCCN, or National Comprehensive Cancer Network, which is a good resource for the patient regarding their diagnosis and helps to explain treatment and their care. The National Comprehensive Cancer Network is used by providers for diagnostic workup and the gold standard in treatment decision for best patient care. Here at Novant, we also have a lot of different programs that fit a lot of different needs for the patient in our Cancer Institute, such as our caregiver support group and our post-survivorship support group. Each of those meet monthly. We also have a lung cancer support group in Charlotte that meets every month in person. It's a good way to network with other patients with the same diagnosis. They have a different topic and speaker each month. And there's also a small cell lung cancer support group that meets monthly, and it is virtual.
And that's great. So there's plenty of resources out there to help cope and navigate the world and the journey of lung cancer, which is great, but we can always continue to add more to that list. So the next question, Donna, is how can I prepare for appointments with my oncologist or other specialists, and what questions should I ask them?
So at the very beginning, there's a lot of appointments that are scheduled. It's very overwhelming. This can happen from the very beginning. Say there was an incidental finding on a scan, and there starts the process to meet with a lot of different specialists. And this can go, like I said, from the very beginning all the way through diagnosis. So there are consults possibly with thoracic surgery, medical oncology, and radiation oncology. Make sure when you come to your appointments that you have questions that you're thinking about written down already, and just bring them with you. There's a lot of information that's discussed at these appointments, and it's very overwhelming to try to understand the medical terminology and remember what was told to you as far as the diagnosis. Make sure you bring someone with you, like a family member or a friend. They can help listen, because if you come alone, many times you won't remember maybe 50% of what was said, even if you take notes. And if you have another set of ears in the room, that will help you later when you're trying to talk things out and remember everything.
Great points. And then, sorry.
Questions that you could, I'm sorry.
No, go ahead.
Questions that you could ask at the visit are, what does the diagnostic workup look like, and how many appointments will need to be accomplished to get to the diagnosis? And then once that diagnosis is made, the question to ask is what stage of lung cancer, the prognosis, and do I have a targetable mutation? What does the treatment regimen look like, and how long will that take each time, and over how many weeks or months?
That's great. Those are great questions to have. So to end the section, I'm going to ask, what are a few important points from the many that you've stated that you want patients and caregivers to know about lung cancer?
Lung cancer is very treatable, and it can be curable. The treatments have become very personalized over the years, with more advancements in research on the horizon. It's always okay to ask more questions of your care team. Even if you have asked those questions before, don't hesitate. We don't mind. We're here to help you on this journey and try to make it easier for you. And utilize your nurse navigator, whether it is at Novant or another institution that you're going to. That nurse navigator is there to help problem solve any barriers in your care, such as management of multiple appointments, transportation, and social needs. We have access to so many resources that can help you along the way. This may be very new to you, but this is not new to us, and we want to help you along this journey.
That's right. That's great. So I think we're going to jump now into some of the questions that were submitted for treatment related. So we'll go ahead and address these. This was submitted by the group. So I'll start with the first one is, what are the most promising new treatments or clinical trials in the field of lung cancer, and how have they changed patient outcomes? Immunotherapy and targeted therapy represent two of the greatest recent advancements in the treatment of lung cancer, offering new avenues for patients that were previously very limited by traditional treatments, like chemotherapy. Therapies like Tagrisso, for instance, have proven incredibly effective for patients with EGFR mutated lung cancers. What's even more encouraging is that this field continues to evolve rapidly. As research progresses, we are seeing more precise and tailored therapies emerge, improving outcomes and survival rates for patients who previously had limited options, to be honest. Having conversations about these breakthroughs is critical because it keeps patients, caregivers, and our medical community informed and engaged with the latest advancements that are reshaping the fight against lung cancer. And these are conversations that the patient should be having with their medical oncologist. The long-term remission and cure for stage 4 disease were virtually unheard of until immunotherapy. In speaking to one of my medical oncologist colleagues here at Novant Health and Presbyterian, he informs me that he has a growing number of patients with stage 4 disease at the time of diagnoses that are now 3, 4, 5 years out or more with no evidence of active disease. And that is such a huge win for this patient population. So it's very exciting news to hear that. For extensive stage small cell lung cancer, he also informed me that tarlatamab is pretty exciting and something that we only just recently started using in thoracic oncology. So for our next question, I'm actually going to start with Donna. If I was a patient with lung cancer, how do I manage side effects from treatment, and what support is available to help me cope with those treatments and side effects?
Well, at the beginning of your treatment regimen, you will meet with your healthcare provider, physician, or nurse practitioner to review the possible side effects of your treatment. This will be a time when you can ask a lot of questions and you will receive education on management of any possible side effects with medications. One of those might be nausea. That will be reviewed with you at the time on how to take it and how often. All of this will be given to you in writing to reference when you go home as well. But don't hesitate to contact your healthcare team if you're experiencing problems, even if it's after hours or on the weekends, because if you're having any issues that can be addressed quickly, we want to do that for you so that you don't have any problems that are causing you more distress. We have a palliative care department that's beneficial to patients while they're receiving treatment. They help with management of side effects due to chemotherapy. We also have integrative medicine, which utilizes complementary therapies such as massage and acupuncture. We also have a cancer wellness program that helps with fatigue management, that helps patients' overall health and quality of life.
That's great. That's great resources to mention. Another thing I'll mention, just because we're talking about lung cancer awareness and screening, especially for our early stage patients that do go under surgical resection. Obviously, surgery can be a very scary thought process for a lot of our patients. I will say there's been so many advancements with minimally invasive surgical resection with robotics that patients go back to their daily lives with minimal side effects from surgery or symptoms, I should say, that they can go back to work after 6 or 8 weeks after having lung resection for lung cancer. So there has been huge advancements on that. We also have multimodal pain management for our patients and great care that's provided here by our thoracic surgery team for the earlier stages. So I'll jump on to our next question. And it's about biomarker testing. And I know we've hit a couple of these in our discussions throughout the process today, but the question is, can you discuss the role of biomarker testing in tailoring lung cancer treatment plans? Biomarker testing is a key component that guides your medical oncologist to specialize and direct the individualized treatment plan for you as a patient or for a loved one that's going through lung cancer. It is a crucial thing to have done. And during this time, it can take a couple of weeks to get the biomarker testing performed and the results to be back to your medical oncologist. And it is very difficult to have the patients during the time because you want to start treatment. But I will say it over and over, it is worth the wait for these biomarker testings to come back and for your medical oncologist to be able to provide to you the individualized treatment that you need for better outcomes. The key to the advancements in immunotherapy and targeted therapy lies in our growing understanding of the genetic landscape of each of us or each patient's tumor and how their immune system interacts with it. As technology continues to improve, we're now able to better measure and assess these factors in real time, which is paving the way for a more precise, personalized treatment strategies with you and your medical oncologist. This progress moves us away from a one-size-fits-all approach and towards therapies tailored specifically to the unique characteristics of each patient's cancer. Patients should feel empowered to request the genetic testing if they haven't been offered them, as this is a critical information, like I said it earlier, and it can guide the treatment decisions to be more specific. It is important that the patients take the time to sit down with their oncologist to review these test results, understand their implications, and discuss how this data can shape their care plan moving forward. This shifts the approach of it, not only promises to improve outcomes, but also enables patients to play a more active role in their treatment journey, which I think is huge. So that's biomarker, which, I mean, like I said, it's something that it's a must. So our next question, it says, for patients with early stage lung cancer, what are the key factors you consider when recommending surgery versus radiation versus chemotherapy? I will say there's going to be a couple of different things that you want to look at. And one is going to be the staging of the lung cancer at the time of being diagnosed. The location of the tumor, is the tumor resectable or not resectable? As well as, is the patient able to tolerate and undergo a surgical procedure? It is a complex procedure, and even though we have so many advancements that we no longer are doing that big open thoracotomy incision, we do it through really tiny incisions, it still can add a stress to the patient's heart and other vital organs. So we, in thoracic surgery, will order an echo to check for heart abnormalities and to make sure that the patient can undergo surgery and can tolerate the stress of the surgery. We also do a pulmonary function test to check the lungs. It's a great test. The test predicts if the patient's able to tolerate the procedure and how will they do from a pulmonary status after the lung resection. Will they need oxygen or will they not? So those are key components between, are you a surgical candidate for lung resection, or should you go to radiation therapy? It's ultimately up to the patient, but thoracic surgery with lung resection for lung cancer, if it is resectable and you are a candidate, it is the standard of care. It also allows us during surgery to get lymph nodes dissections and take them out and send them for pathology. And about 20% nationally of patients get upstage after lung cancer surgery. And this allows to decide with your medical oncologist and your thoracic surgeons, do I need more treatment after surgery, or was the surgery curative? So I think it's a big, to put the patient in that position, it's great that we're able to resect the cancer and also be able to determine, are you cured from lung cancer? As for the chemotherapy, it all depends. I know we have a lot of advancements in the perioperative and the neoadjuvant practices that allows patients that have a later stage lung cancer that previously were not amenable to resection, that now can start treatment with medical oncology and then come back to thoracic surgery for resection. So there's a lot of different pieces that come into play. And then the last question is, what scientific advancements do you foresee taking place over the next 10 years related to lung cancer? And with this question, I did have more comments and more conversations with my medical oncologist colleagues. And immunotherapy and targeted therapy, which initially revolutionized the management of metastatic disease, are now showing incredible promise for a broader application. Looking ahead, I see that these fields continue to evolve over the next decade to include not just metastatic cases, but also the perioperative and the adjuvant practice for our patients. By integrating these therapies earlier in the treatment process, before or after surgery, we can potentially improve survival outcomes, reduce the risk of recurrence, and move closer to a more personalized, precision-based approach for all stages of lung cancer. As these therapies continue to develop, the hope is that they will be used more proactively, ultimately changing the standard of care and offering more patients a better chance for long-term survival. So this has been a great dialogue between Donna and I. Let's check in with Lauren Love and see if there's any further questions that have been submitted into the Q&A box.
Yes, we do have a few that were submitted. And I'll start with this one. How can I help ensure that my loved one has the best quality of life throughout their treatment, specifically when it comes to managing pain or fatigue?
Well, I think I may have touched on this earlier, making sure that you discuss this when you come in for your visits with your medical oncologist and ask for a palliative care referral. I think that sometimes that's underutilized and they can help very much with pain management while you're undergoing treatment as well as other side effects. So I think it's just important to have that conversation and support them as much as possible.
Donna, I think this is a great topic, palliative versus hospice. Do you mind just sharing with us a quick little sentence or two of the difference so patients can be aware, or, loved ones, that there is a difference, and palliative doesn't mean that they're not going to get treatment?
Right. So hospice and palliative care, they work together. But whenever we bring up palliative care, I think there's some hesitancy from the patient's side because they think that means, maybe we're sending or referring them to hospice and we're not going to treat them further. And that's not what that means, because palliative care, they want to support the patient. You're still undergoing your same treatments. It's just a matter of them working with you and working with the medical oncologist to make sure that they are hitting all the, concerns that you may have with side effects and managing that so you have your best quality of life so you can continue your treatments.
That's great. Thank you for sharing that.
We do have two more questions. I think we can have time for both of these. Are there dietary or lifestyle changes we should consider to help manage treatment side effects or improve my loved one's overall health during treatment?
So I think that, just a general well-balanced diet. I know you may hear that a lot, but that is very important. I wouldn't strictly prohibit certain things. You don't want to eat a lot of empty calories. You do want to get very nutritional based meals. We do have dietitians that we refer our patients to, and they can sit down and go over a lot of this in detail and give you printed material as well. So they're an excellent resource on our team to help the patient.
Absolutely. Nutrition's great for any type of treatment that the patient's receiving, especially from a healing perspective, whether it's surgical, radiation, or from medical oncology with the treatments. Absolutely.
Okay, one last question. How would you recommend I find out about clinical trials available for my type of lung cancer that I may be eligible for?
I would say that would be a very great discussion with your medical oncologist. What do you think, Donna?
Yeah, I think so. I think it's always a good idea to ask when you meet with, and that could be one of those questions that you ask when you meet your oncologist, and ask if there's a clinical trial that's available to you at this institution. Sometimes, and it's also okay to ask for a second opinion to go to an outside, a regional institution such as Duke or Chapel Hill, or, others that are outside of the state. Excuse me, to look at those possibilities for clinical trials.
I will say, Lauren, I'm going to add this. I know at our facility, our institution, the great thing is it doesn't matter which medical oncologist you're seeing. Obviously, we've subspecialized, which is a wonderful thing. But we also have monthly meetings that they provide information of what clinical research and trials are available and which ones are coming down the pipeline. So I love that for our organization because it allows us to communicate among specialties as well as within the medical oncology specialty. So all the providers are very heavily involved in that. And I think it just allows for a better patient care and for research to continue and for better treatment options for our patients.
Thank you both so much. Before we conclude this session, we want to share a few important resources regarding lung cancer. The American Lung Association is committed to supporting those impacted by lung cancer, and we are so proud to partner with organizations like Novant Health to improve lung cancer survival rates throughout North Carolina. So for more information, I'd encourage you to visit the websites that are listed on your screen. We will include this information in a follow-up email, so no need to write them all down. This has been a wonderful conversation. Thank you all for attending today's Community Connections. I hope that you found it informative, and we are so grateful for our amazing panelists. Thank you, Jalady and Donna, for your time, your insight, and your service. Thank you all so much. I hope that you have a wonderful day.